My name is Rachel Simmons, and I have the privilege of being the Internal Medicine Residency Program Director at Brown. I've always enjoyed science and working with people, and that really drove me to medicine. Medicine is a very unique field. There's so much that you can integrate into your practice. I am an infectious diseases physician as well as a general internist. I really love being able to use both of those parts of my training to both have some really very specialty knowledge, but also look at the patient as a whole. That is one of the things that I love about being at Brown. I think a broad practice really thrives here. Among all of the careers available in internal medicine, you need a very strong foundation in general internal medicine, and I think we do that very well. It is our privilege through the 3 hospitals that we work at that we see everyone from all walks of life and across the state of Rhode Island. You have the opportunity to train on the inpatient side at the VA. It's the largest healthcare system in the United States. You also have the opportunity to work at the Miriam Hospital, which is an academic community hospital of about 250 beds. And then you work at the referral center for the whole state, which is Rhode Island Hospital. On the outpatient side, I think you get broad clinical training in general internal medicine. Not only do you have your own continuity primary care clinic, you also get the opportunity in your 2nd and 3rd years to have a longitudinal clinical experience with either a primary care physician at our academic practices with faculty or in the community, or with a subspecialist of your choosing. Those 3 things combined really set the stage for a really solid foundation in medicine that you can use to really do anything in your future. We have multiple tracks that people can be involved in. We have global health, we have a research track, we have a clinician educator track, women's health, and our last track is the arts and medicine track. Every single track is an example of how residents saw a need or a desire, and it was put into place and has been maintained by the program. And then for research specifically, I think we support it in multiple ways. We have a director of resident research who has broad knowledge of all of the opportunities available at the institution, as well as resources like navigating the IRB, like statistical support, as well as research design support. And we have a quality improvement analyst that has helped multiple trainees with their QI projects. And those QI projects have gone on to, national meetings as well as papers. We also support individuals once they get their work accepted. We support their attendance, both the travel and the registrations. There are some things that really stand out to me about our residents and their careers. I think that they are folks who really care for each other and their community and really see that as part of their mission during training. And we foster that in the leadership and among the chief residents. Diversity and inclusion is a big priority for us as a residency, as a department, as a healthcare institution, as well as a university. There are 2 groups I want to highlight that we work with regularly. One of them is the BMHA, the Brown Minority House Staff Association, and the other is the Brown Sexual and Gender Minority Alliance. As well as, Brown Medical School has a program for a healthy learning environment, which we take part in. As soon as people come, they take part in a curriculum called Bias Reduction in Internal Medicine. That is a well thought out, well-resourced national curriculum that we've been able to incorporate into orientation. We've rolled out several initiatives, including a Justice, Equity, Diversity, and Inclusion noon conference series. It's not only internal medicine that thinks very deeply about this, but it's also our health system and our medical school. At Brown, we really want to get to know our residents as people. Everyone has a story, everyone has a background, has goals, has things that they want to do in both their personal and professional lives. Life does not stop just because you are in a busy professional moment. Some of the things that we are really excited about over the next several years are thinking about ways to help people continue to personalize their time in residency. If you're someone who is really interested in primary care, how do we make sure that you are getting all the skills that you need? And then we're working on, more protected time for learning, which we think is an exciting sort of forefront. And then you have to make that experience something that people really want to go to. So it's going to be interactive, it's going to be workshop-based, it's going to be a lot of fun.